Can you hear?
Yes, we can hear you very well. Thank you.
Yeah, thank you so much, Arun, and respected chairperson, and all the moderators for this session. I'm really excited to do in such a wonderful refractive OT. In way back 2008, when Dr. Ganesh started his other center in Mangalore, Dr. Ganesh taught me how to do LASIK. Really, very much proud that doing surgery in front of my guru, Dr. Sri Ganesh. Thank you so much, sir. I always call Dr. Sri Ganesh. I wanted to tell yesterday only, just before starting, I wanted to tell. I always used to tell one Dr. Sri Ganesh is a superstar of in ophthalmology. And as a president of Karnataka Ophthalmology Society, Dr. Ganesh has got a named oration award in his name here in his name that we be always telling your name, sir. The man, I think, tell about refractive, probably the number one in the world, not even in so much. So about this case, to Hela, and the right eye power is minus 7.25 with 1.25 cylinder, and left power is around minus 5.75 with the 1.5 cylinder. So as yesterday, my talk, all this the dominant eye is right eye. We make metro non-dominant eye myopic by 1.5. The effect of almost 2.5 diopters, which is sufficient for any throughout. Have to even repeat procedure after 3-4 years. This is for lifetime. I think the best example, again, my undergone Presbyond in the same 8 years and the same surgery. He's so happy. His vision is 6/4 and N5 for the ultimate technology. So the fluence test has been done and has been calibrated. So about the MEL 90 excimer system, this is a spot laser which is has got both 250 and 500 hertz, but he be doing the Presbyond is the 250 hertz only. So already flap has been done with the Visumax, but also have got a Visumax, which is the latest of Zeiss refractive platform. So we'll be shifting the right now. Be doing the
Just relax.
ಬೇಗ ಜಾಸ್ತಿ ಬೇಕು ಮತ್ತೆ ಕಡಿಮೆ ಮಾಡೋಣ.
So the patient details are on the left screen. Can everybody see that?
Yeah. Just show the patient.
Perfect.
Yeah, just I'm lifting the flap. This is a new flap lifter. First time I'm using in my career. Always Dr. Ganesh uh, uh, designs his work.
Adjust ಮಾಡಿ
Actually, what I think
ಸಿಕ್ಕಾಗ್ತಾ ಇಲ್ಲ ನೋಡಿ.
when it will be in exactly in the same. Do the eye tracker. So I'm just firing the laser now.
ಟೆಸ್ಟಿಂಗ್. ಓಕೆ. ಸ್ಪಂದನ.
Treat.
Just keep your eyes closed. Keep your eyes closed.
So ಇದು ಯಾವ hinges superior now.
Okay. We should talk.
Underneath the make sure that it's done perfect. As I already said that Visumax is amazing. One more advantage, it's a soft laser, so the
That was excellent surgical procedure, Dr. Kudlu. Can you explain when you said you had used some instrument for the first time and yet did so well? What was that instrument?
innovate. Society and also All India Technological Society. In 99, got my father track surgery to Dr. Ganesh. About needs almost around 50. Open. ನಾನು ನೇರ್ ಸರ್ ಅದಕ್ಕೆ ಫಸ್ಟ್ ಇದು is over now. Shifting the again. I am very much impressed with flap. I think I could able to one case. Not to Ganesh, you within overall aim, because he tracks surgery short and refractive probably we are surgeries. The surgeon in Singapore last time. Think Hong Kong. So you could able to see the flap very well. I also got adjusted system with one only. And as so, left eye of this patient. Dry this. Fine. No. No. Fine, sir. Treating the non-dominant eye. Treatment done really well. So again, a few introduction about the Presbyond. I think I've been doing this technique for around 14 years. Probably the first user in Karnataka, first few user even in India. Probably the best available refractive, available presbyopic solution available in the world also. But make sure that your all pre-op checkup is perfectly done. Make sure that patient don't have the cataract. Your dominant eye testing is very good. Your micromonovision testing is also perfectly done. Once everything done, then the all software takes care about the treatment very well. So it's again making the dominant eye emmetropic, making the non-dominant eye myopic by 1.5 diopters with creating a controlled spherical aberration in both the corneas. So gives a effect of almost around 2.25 to 2.5 near vision. So patient need not have to undergo one more time or repeat of this procedure. And I have operated more than 1,000 plus patients and the results are amazing. And the market is presbyopia in the coming days. Most of the parents who have been like their children been operated for LASIK or SMILE, they come that do I have any solution to get rid of my glasses? Still, patient, if they don't have the cataract, I think my preferred choice, even up to age of 55, 60, is Presbyond. So I'm just putting the BCL to the patient. The one more advantage of putting the, all patients will be very comfortable for a day. Otherwise, normally they tell that they'll have a sort of a foreign body sensation, but they'll be very comfortable. You can remove the BCL after a day or two and patient can get back to his work very well. About the adaptation, yesterday I was telling, Ganesh get adjusted within 10 minutes of the surgery. He could able to see all his near vision, but most of the patient get adjusted within 1 day, or some of the patient emmetropic presbyopic may take up to a week or two, again depending upon the patient. But all patients, if your pre-op workup is very good, probably again I am telling you the best presbyopic solution available till date. Thank you. Again I thank Dr. Srigesh, Dr. Supriya and whole Nethradhama team. It's a wonderful question. Any questions, Arun? You can.
That was an excellent surgical procedure, Dr. Kudlu. And just one question I had. You mentioned you had used some new instrument for the first time and yet did such a wonderful performance. What instrument was that?
Sir?
You said you had used some instrument today for the first time.
Yeah, that is a flap lifter I am using for the first time. First eye I could able to actually get adjusted, but second eye I am already okay with it. But it is very good. The flap lifting took almost a few seconds, so the overall procedure is very easy. This is one of the best refractive OT I can say. All equipment around and the comfort of the surgery is too good. You can breathe easily, and the top star is who is standing next to me, and like a bodyguard is standing next to me. That is the I could able to do the case quite easily.
Well, the surgery looked absolutely flawless. Congratulations. And any questions from the audience here?
I just had a question to Krishna Prasad. What is the ideal power range for Presbyond surgery?
See, as I already told, from emmetropic presbyopic up to -8. See, this patient had almost around 8.5 diopter with right eye it is 7.75 with 1.2. That is almost around 9. Once again, depending on Phaco value, how much is the Phaco? If Phaco is very good and all other investigations good, I think you can do whatever the power. Hypermetropic, you can extend up to 4.5 diopters, even up astigmatism of 3 diopters.
Thank you. Dr. Kudlu, Dr. Grewal here. Thank
Good
you so
morning,
much
sir.
for excellent surgery.
Thank you,
I
sir.
have one question, that when this patient needs cataract surgery 20 years down the line, what lens will you choose?
So actually, in my last 18 years, around 3 patients we had done the cataract surgery. Normally what we do, we put a non-aspheric monofocal lens, probably positive lenses, like I use the 204 model from the Zeiss, which is a non-aspheric lens. What I do for dominant eye, I put the exact, make it emmetropic, and non-dominant eye, I make 1.5 diopters. So whatever the effect what you have done in the cornea, that remains afterwards also.
Thank you.
Thank you so much, sir. We are shifting to the other OR.
Dr. Krishna Prasad,
Yeah.
what formula do you all use for
What?
calculation?
What?
Formula do you use?
No. There is no formula actually. This is a Presbyond.
No, for cataract, for the cataract.
No,
formula.
Exact intraocular lens power.
Thank you very
Thank you,
much.
sir. Thank you, sir.